Senator Ford, we are ready to go. You're on.
Thank you. Can you hear me, Mr. Moss?
I can hear you.
Great, thank you. First of all, I'd like to say welcome to everyone who has joined us on the call this evening. As chair of the Mississippi Legislative Black Caucus, I'm extremely proud and I'm thankful to present the content that we're going to share with you this evening. We have engaged Mr. Felton Moss, who is a rising star in all things related to education, and he has graciously put together a panel for us, and we're going to be hearing from him shortly. But I'd just like to let everyone know that the Mississippi legislative session resumed today. The Senate went in at 10 o'clock, and we received an update from the state economist as well as from the executive director for the Department of Revenue. And our call tonight, this evening, is most timely. We know that we're in the midst of the coronavirus pandemic, which has definitely affected our education system. And those are some of the issues that we want to talk to you about this evening. So Mr. Moss, we're going to give you the floor for you to go on and make your presentation. You have advised the caucus on matters of policy, and we know that you're going to present some great content for us this evening. Thank you, Mr. Moss.
Well, thank you, Senator Turner Ford. It is indeed a privilege to have the opportunity to engage with each of our participants tonight. We're excited at the overwhelming response of participants who are here to talk about equity tonight. And we are certainly thankful to our Legislative Caucus for prioritizing issues of equity and access in our communities, particularly amid the COVID-19 pandemic that's taken place. Again, you heard from Senator Turner Ford. I am Cortez Moss, excited to serve as your moderator on today's call. I'm gonna jump right in. As we think about the call, one of the looming issues that we've heard from our own state economist today about the amount of money that we stand to lose given this virus. But national predictions are wide ranging, but most of them suggest, and current economists suggest, that we could see extraordinary costs for healthcare and unemployment, and those things could produce a reduction in state education revenue of at least 10% this year and 20% in 2020 to 2021. We learned that from the Learning Policy Institute, who are leading and doing work nationally with regard to education policy. And so that is really guiding some of our thinking and some of our concern. Our state economist today has projected billions of dollars in loss to our state economy. What that speaks to me as someone who's concerned about policy and someone who's concerned about our ed system is just at the teacher level alone, we can expect to lose about 4.9% of our teaching population just with a 15% decline in funding. That is essentially doubled. That projection is doubled when we consider what the Learning Policy Institute has found for us. Our source here is the National Education Association Bureau of Labor and Statistics. That's a lot of teachers to lose, particularly at a time when, just 2 years ago, we were short in Congressional District 1, 237 teachers. In Congressional District 2, we were short 479 teachers. In Congressional District 3, 221. In Congressional District 4, 130. These numbers are astronomical. That means we started the school year with kids not having those teachers. And if schools and districts have to take additional measures, we could stand to see another 4% of our teaching population downsized. We know the larger classrooms get, the more difficult it is for teachers to support learners and give them that individual support that they need. So that is alarming and concerning to me, and our superintendents are going to address that on the call today. More profoundly, an issue that is really near and dear to me is early learning. We've made incredible strides as a state as regard to early childhood education in our state. Our collaboratives that are state funded by legislative dollars, we heard lots of reports prior to COVID-19 of an interest from our legislative body to actually increase that funding to expand our pre-K collaboratives and do more for more children. The spring 2019, our statewide average score for pre-K was 575. What we're expecting, a readiness score of a 530. So our students who were participating in those collaboratives were beyond ready to enter kindergarten. However, we're only serving approximately 3,000 students in those collaboratives. That's 7.9% of the 4-year-old population that is in our state. So we have much more students to serve. And we know that the sooner we can get kids learning and the more ready they are for kindergarten, the less work the kindergarten teachers have to do in order to make sure kids are college ready. I tend to believe that college preparation begins at pre-K. I'm a little bit more liberal with that thinking. I believe it begins the day that a scholar enters this world. And I probably could go even more liberal and talk about the day that the child is actually beginning in the process. We have lots of work to do, and it's concerning, and we hope that we can find ways to ensure we put more students in pre-K. But I really want to think about something that's in the title of our session today, is equality and equity. For many years, we heard the dialogue around we need to have an equal system. We look at B versus Brown, Brown versus Board of Education, and we talked in great deal about having an equal system. I submit that we've gotten to a place in our gesture as a world and society where we need to change that conversation from equality to equity and up that conversation in a system that's equal. What we notice is that every participant in that system is getting the same educational capital. So if you're a student that is from a high socioeconomic status background, you have an effective or an experienced teacher, you have low teacher and leader turnover, you have rigorous course offerings, and you have lots of enrichment opportunities. You get the same capital in our current system as a student who is from a low socioeconomic status background, and they have a less effective or novice or high teacher and leader turnover. They have standard course offerings and not necessarily course offerings that that advance the trajectory as their counterparts do that are from a high socioeconomic status. What I am interested in is a system that looks like this, friends. One where we see more capital going to students are from a low socioeconomic status background. They currently have uncredentialed or novice teachers. We see high teacher leader turnover, standard course offerings, and limited enrichment opportunities. We have to figure out, particularly when so much funding is going to schools amid COVID-19, we have to work intentionally to ensure that we get more capital where it is needed and distribute those funds equitably. For those of you who are mathematicians, I am intrigued by my friend, Dr. McCrae, who put together some guidance for as we think about policy making, the types of equations that we should be applying when we create policy at the district level, the national level, state level, is that we need to think about the need index and we need to think about educational capital. And so when we put someone's need index and we multiply it times the capital that's necessary, the policies that we create can either negatively or positively impact the outcomes that we want to be true for our kids and scholars in our communities. So as policy making happens, we need to be more thoughtful about it. We need to ensure that it does not adversely impact the need index, but rather it has a positive impact on the need index. If you put a negative exponent there, you will see something different happen with this equation. You put a positive one there, you will see something increase. And thus we have educational equity. This is my good friend, Erica McCrae at the University of Florida. This is certainly in progress, but you are free to use it. And at the end of this call, I will actually share the slide deck from today's call. So if you'd like to use this. But we want to engage our leaders today in this conversation around how do we get more capital where it's needed, particularly in places where students who are in poverty or who have less effective teachers or who have few teachers. How do we get more to them? I'm so thankful for, I had an opportunity to work at the Department of Ed prior to going into consulting, and Dr. Wright challenged us as leaders at the agency to think more equitably about how do we get resources to districts. And that's not something that is solved overnight. It is something that we have to be hard pressed to figure out daily. And so I don't want to leave you without a resource before we jump into our larger conversation. These are two books that for superintendents, our principals, our teachers who are on the call, or folks who are just largely interested in the education reform space and movement, who are interested in equity-focused leadership, I submit to you that the listening leader, creating the conditions for equitable school transformation, it puts us on a journey and a path towards listening to kids and listening to teachers and families and communities in such a way that inspires equitable systems. And then principles of inclusion. How do we create more inclusive environments for kids and for teachers and leaders and families all across our system? So if you're looking for something to read, these are two texts to continue your equity journey. But I wanted to take a little time and ground our conversation and set you with where we are today. I'm going to introduce our panelists and then we will jump right in. Our first one is Ms. Kelly Riley. She serves as the Executive Director of the Mississippi Professional Educators. We are thankful for her leadership in legislative fight over the years and concern with issues of equity and access. We have Ms. Erica Jones, who is a lifelong teacher, leader, professional who currently serves as the president of Mississippi Association of Educators. Her leadership was groundbreaking and instrumental in how we thought about our upcoming legislative session with the Association of Educators. And so we are thankful to have her voice in the space today. Next, we have Dr. Amy Carter, one of our foremost and formidable leaders from Meridian Public School District, who has always thought about issues of equity and access for kids in our communities. Excited to have her. We have Dr. Eric Green, who is, well, he's not newly minted anymore. I was gonna say newly minted JPS superintendent. We are incredibly proud of the great work that he's been doing in a short time in JPS. He brings a background in fighting for equity all across this country. So hearing his voice in this conversation today will be instrumental. Dr. Deborah Dace will join us a little late in the call. She has a board meeting that she is finishing up. She is the newly minted superintendent in Greenville Public School District. She's worked all across the Delta region, supporting kids and families, been an equity champion. We have Mr. John Taylor, who is relatively new in his superintendency, but prior to that, he worked with Dr. Amy Carter in Meridian as an assistant superintendent, thinking strategically and deeply about academics and how we support kids with strong systems. And so he has returned to his hometown, the Mississippi Delta, to lead. We are tremendously excited about the wealth of experience and knowledge he will bring. Dr. Cedric Ellis, who has worked in multiple parts of our state, joins us tonight, but he's currently in the Macomb School District. We're excited about the equity work that he has done there in Macomb, and he will speak to the transformation work that he has been doing there. And then we have Mr. Claude Garth, who is joining us from the Hazelhurst School District, who has also been in some turnaround work in much of his career, having started over in Aberdeen and moving to Hazelhurst. So we're excited about his perspective. But we're going to jump in tonight and start with our first question and give each of the panelists an opportunity to really jump in and answer this question that's so important, I believe, as we think about the new norm that we're in. We use the term new normal, but the reality is many students lack of access is their normal. This is a tremendous opportunity to better understand the daily experience of those students who do not have access to what they need to be successful. What does that mean for your work as a leader in education? And we will start with Dr. Amy Carter. Dr. Carter, would you please begin? We'll hear from all of our panelists on question one.
Sure. Good evening, everyone. For me, when I think about the new normal, I think about the importance of having a laser-like focus on what students need. Back on March 16th, when we were told that we would not be returning back to school, the first thought that entered my mind was, how can I ensure that all of my students have a healthy meal? Most people were trying to figure out what they were doing academically. I had to initially figure out, how can I ensure that my children got breakfast and lunch every day? So it was critical for me to reach out and partner with community agencies like the Boys and Girls Club. We had already set up locations throughout our city for pickup meals, but when you're educating students in about 10 housing developments, I knew that a lot of those students would either be in danger of walking to those places to receive meals, or I had to go out and provide those opportunities for them. So in conjunction with local leaders in our community, such as our pastors, our Boys and Girls Club, we immediately said, okay, let's make sure our children have access to breakfast, lunch, and dinner as well. Then from there, we started talking about what academic resources were necessary that we put in the homes of our children. So we immediately reached out to the United Way and started talking about getting books in the home. We immediately asked our teachers, within that first week, please make contact with our families. Just make sure they know that you're here. Don't talk anything about academics. Let's talk about how their families are doing, what they need of us, and just let them know that we're going to be here for them throughout the course of this, especially very early, not knowing how long it would last. Immediately after that, we started looking at surveys to determine access, and I know we'll get into that a little bit more. So when I think about the new normal, it was really about me trying to make certain that our families knew that as a school district and a community that we're here for them, not just from an academic standpoint, but from a social emotional standpoint as well.
Yeah, Dr. Green, would you lean in there a little bit? I know you enjoy talking about social emotional learning. I spent a credible time doing work around the country on it. So would you lean in there?
Sure. Very similarly, we too found ourselves spending a great deal of time thinking about and trying to identify resources for meeting some of the very basic needs of our scholars. And while very quickly you look to food insecurities and perhaps even insecurities, there's also just challenges around social and emotional needs that I'm thankful that I'm starting to hear many more educators and non-educators, folks who believe in the power of public education, talking about social and emotional needs, but that's, it always was a huge issue, and even more so now as we think about the immediate kind of crash and impact of this COVID-19 pandemic and the residual and continuing traumatic effects that it has had and will have on our young people. So for sure that. But also, I think for a lot of us, what we knew and experienced to be inequities in education and in resourcing and just situations that our young people find themselves in, we're also peeling back more of those layers. And so, I might have a parent who's available to might have a parent or some adult who's able to support me at home. I might have the devices and connectivity. Might. For many, that's not true, but I might have that. But then, what is their capacity if there's an adult to support, capacity to support in my learning? Do they have gaps in their learning and education that make it difficult for them to engage with me as I'm trying to muddle through? Because remember, there was no plan to take the learning online. We just flipped a switch, and all of a sudden it's supposed to be this pristine thing. At least I think early on we kind of assumed that would be. So yeah, those kinds of resources, and then just the ongoing needs around supporting young people to make sense of what is becoming a bit of the new normal, and building a muscle on learning remotely. Because in addition to our muscle building as adults, we've got to ensure that the young people can manage themselves to some extent in this new normal and drive their learning and remain attentive to the learning in ways that they just haven't had to. I'll pause there. There's so much more I think that we could say about this, but not the least of which is that work around just readying young people as well as the grown-ups to deal with trauma and traumatic effects.
Yeah, Superintendent Garth, want to bring you into the conversation. What's your thinking here?
Very, very similar to what's been stated. I think it's an opportunity for us to do some really good work in education. If you're in a district such as mine, or you've worked in places that were turnaround institutions and LEAs, you understand that we've always had deficits. So this is an opportunity to try to go back to ground zero and to rebuild some things that were probably done in a faulty way for a long time and with a lot of inequities attached to it. So this is an opportunity when crisis hits everyone and you have to reboot the entire system. How do we manage to get ahead now? Because we're all having to do the same things to come up. That it doesn't matter really about where you are. There's some fluency issues, and we know those things we talk about, but this is a moment for a school district to be creative, to be innovative, and to be able to say, we're going to make it work for our population, for our students to have success. That means thinking outside of the box, which means a lot of the norms we've used in the past, you can't pay attention to them anymore because they don't apply to our new normal. So to be honest with you, I won't say that I am happy with crisis at any point, but anytime you have crisis, you have opportunity. And I'm going to make sure that my school district runs with that opportunity. And I'll learn from some of my colleagues as well on what they're doing that's very awesome. But we're going to take this opportunity to build a much better school district for the next decade, the next 20 years, because we know one thing, we're not going back to what we used to do. And since we know that, we may as well move forward in the most progressive and the most innovative fashion as possible.
Thank you, Superintendent Garth. I want to just say I have dropped 2 links in the chat, the agenda for tonight's call, as well as the slides. It is my understanding that I was not advancing the slides. I was just talking so much earlier that I didn't advance the slides, but I want you to be able to have links and access to those. But Ms. Jones, having been a teacher most recently and now leading an organization with all kinds of teachers across the state, what's your thinking here in this new normal, and what kind of leadership is it calling for?
Thank you, Cortez. So what we've seen during this pandemic is that equity issues have been magnified. We should not have to have our students to be dependent upon resources according to their zip codes in which they live, but unfortunately that's been the case over the last couple of weeks here. This is the right time for us as leaders to take this by the horns and make it what we want it to be. This is a great time for us to make sure we have qualified educators in each of the zip codes for our students moving forward. One thing we have to keep in mind is that a student's learning condition is also a teacher's working condition. So as we move forward, we need to embrace all of that information and make sure that we're letting our legislators be aware of our concerns and issues that we're faced during this time, and making sure that we are allowing our educators to be at the table when different decisions are being made about what the reopening of schools may look like. And we also need to hear the voices of our educators of the experiences that they had during this time.
Yeah, I appreciate you saying that. Everything I'm reading across the nation about leaders who are leading large systems like the one that Dr. Green is leading, and I think I've heard them talk about it, is as they start developing reopening plans, teachers need to be part of that conversation, and not just teachers, parents as well. Kelly, what are you hearing? I'm going to, I think we're playing with unmute here. There you go.
Well, one concern that I've heard from our members is definitely related to the budget and the fear that the pandemic will only heighten the inequities between districts. I think, as Erica just mentioned, there's some opportunities with the legislature that we really need to zoom in on. For example, right now our schools are funded based on attendance. I'm foreseeing, and I'm hearing from a lot of our members throughout the state, that they are afraid parents are going to be extremely sensitive to if their child is sick, or if there are rumors of, oh, a bunch of kids in my child's class have been exposed, but they're not going to send their students to school. That's going to impact our funding for schools throughout the state. So I really think it's an opportunity for us to push for funding based on average daily membership rather than average daily attendance. Our members are also concerned with the inequities that are possibly going to arise related to reopening. If you look at those CDC guidelines, or considerations as they call them, it's going to be expensive. And some of our school districts do not have the resources to spend on taking all of the steps that are going to be necessary to protect not only our students, but our teachers and our staff. And then finally, we're fighting the ever constant battle of the attempts to divert public funding to private schools. I mean, Secretary DeVos's push has been very public, with her wanting to send CARES Act to private schools, and that is not going to do anything but deepen the inequities among districts in our state.
Absolutely. I appreciate you calling those things out. And we appreciate the work you're doing around those things, because we know you're not just talking about them. You and Erica, MPE and MAE has been on the lines, and we're thankful for your work. Dr. Ellis, want to bring you in the conversation.
Yes, I won't try to regurgitate anything anyone else said, but I think that because since March up until now, I think that we look at this as an opportunity to determine what our students need to be successful. And I think that we, as Kelly said, I think that we also need to use this as an opportunity to intentionally address those students who have been historically underserved. And if we're honest with ourselves, there are students in our school districts, even though most of us serve those students in poverty, students who have been underserved. I think this is an opportunity for us to provide us with an opportunity to assess what type collaboration will be needed and required of staffs and community as we begin to collectively develop strategies, solutions to support our students in their long-term success and well-being as we move forward. I think that we need to know now, and we do know now, that this new normal cannot be addressed alone. It's going to take collective efforts, and we must figure out how do we leverage these resources? How do we leverage our assets? How do we leverage our roles? And even how do we leverage the talents and gifts and passions of the educators and staff that we have in order to, and as we move forward. I think that we need to also determine that a stabilizing force in the lives of our students, because they have been without some of those essential things that they needed during this time, is that I think that it's going to take educators, it's going to take social workers, school counselors, mental health professionals, correctional staff, and other professional advocates to try to stabilize what we're going to need in going forward. So it's going to be critically important. I know that we talked about these social emotional supports, but it's going to be critically important that this new normal also address those social emotional supports, because we know that these things can counter some of those adverse experiences and trauma that the students that we serve have experienced during these times. And I'll just say finally, for me as an educational leader, I think that we look at everything that we've done up until this point to determine how we move forward. And for me as an educational leader, I think that we need to also use this as an opportunity to determine how we build choices for parents as we move forward. Because if we don't give parents options, then one of the things that I know that we're going to do as public education is that there's going to open the cry for more choice via charter schools and public and private schools. So I think that with everything that we've experienced up until this point, these are things that we need to consider for our children as we move forward.
Thank you, Dr. Ellis. Dr. Dace, I want to bring you in the conversation. Will you talk a little bit about what this new normal means for you and your leadership in Greenville, the newly minted superintendent there? What does this mean for you?
Well, I'll agree with the other superintendents and the other panelists have said. Actually, we've always had the inequities. But now with COVID-19, it's a laser-like focus, as shared earlier, on those inequities. Now, don't get me wrong, these are challenging times, both with what do we do next? Of course, as Dr. Ellis mentioned, I believe when COVID-19 came about, we thought, and I think Dr. Green mentioned it also, we thought it was going to be short-lived, come up with a plan that we could use for distance learning. But now this is the new normal. And so I just had a board meeting and I got out about 5:45, but we talked about what were the next steps dealing with COVID-19. And my school board members had lots of questions. which I couldn't really give them answers to because there's so much that's unknown. And so it's the same, you know, with my staff. We are having to plan all of these contingency plans, plan 1, plan 2, plan 3, with some sort of guidance from the CDC. But we do have to think about where our students are. If we go with a plan of true virtual learning, then we have to think about the inequities. We did the survey through MDE, where we assess the level of technology, and I know we'll talk about that later, but we can't just say we're going to provide teaching and learning through virtual learning, because then those students who are already behind will get farther behind. So the new normal is thinking outside of the box. What can we do differently now that we have the opportunity to think broadly? And so we're looking at the CARES Act, we're looking at that funding as well, to think about what now can we provide for our students? What have we not been providing that we now can look to place within those schools? Of course, we have all of these guidelines that we have to abide by, but thinking outside the guidelines now, how can we truly make a difference for our students? Be it virtually, be it face-to-face, be it blended, how can we truly make a difference? And it all has to go back to working with students as well as our community, and working with our parents and bringing everyone to the table. So those are our next steps. School has officially ended. So now what I'll focus on is now planning for reopening. What does that look like? And right now, it's still an unknown to everyone. And so we have those contingency plans that we're going to put in place. And yes, we're going to have parents, we're going to have administrators, we're going to have teachers, school board members, all of us at the table thinking about how can we provide equitable teaching and learning efforts to all of our students in the Greenville Public School District. We don't want them to leave. So we want to provide them options, and we want to provide quality options to our students. So what does that look like? That's kind of what we're wrestling with.
I appreciate you mentioning this notion that the CARES funding is an opportunity to offer something that we have not done before.
Right.
That is an interesting way to begin thinking about that within the guidelines that they've given us. We've gotten lots of federal guidance on how we can spend money differently now. And so let's take advantage of that. This is the last person on this question. Mr. Taylor, would you please give us your thoughts on what does this mean for your leadership in the new norm? Then we're going to transition to a conversation about early learning and pre-K, which I'm so excited about.
Good evening. For me, I guess a driving term would be conscientious. Right now, there are so many facets of the school day that we have to be aware of, from the start of school. What does the bus ride look like now? I'm thinking about how many kids can I put on a bus? And then on a typical route of 60 students, I've got to space them safely. Am I checking temperatures on the bus or when they get to school? You know, it makes sense to check them on the bus. What happens with that student whose mom has already gone to work, who's been waiting at the bus stop, and now he's got a temperature of 103? Do I take him on to school? Do I leave him there unsupervised? There are so many facets to preparing for the start of school. And that's just the bus ride. We're not talking about the number of routes I now have to run, the amount of fuel I now have to purchase just to get that bus of kids. That bus load of kids now becomes 4 bus loads of kids once they're spaced. And then what does school look like? Walking through the halls, the one-way traffic. Do I have kids in the classroom and now the teachers rotate instead of the students rotate? What does that look like? But for us, we talk about the inequity with students, but I'm thinking about teachers. I don't have any teachers who have been trained or who are comfortable with online learning. And I think about my consultants. I have very few consultants who've ever led teachers in this regard. Some of our teachers have, or some of our external providers have taught college courses online. They're more familiar, but it's nothing like teaching a second grader online. So in that regard, engagement becomes an issue. We struggle to maintain engagement face-to-face. now even more so online, how much time can I actually have a class with a third grader for and retain that attention? So this, in a lot of ways, this is kind of like Dr. Green said, we were thrust into this. We could not prepare. My district is tickled pink to have laptop carts. A lot of us have been one-to-one for some years and have kind of mastered using the device for something other than iReady and testing. And we're kind of on the cusp of that, but now we're having to use the device as our primary source of instruction. There are several learners from an equity standpoint that are not comfortable learning through that mode. What does school look like for them? What does success look like for them? So once again, you know, our eyes are always focused on our students, but right now I'm looking at my teachers. Are they comfortable delivering instruction? Are they competent? And someone mentioned earlier, I think it was Kelly, talking about the equity divide could possibly widen for more rural districts that are not as comfortable with this mode of instruction. And again, I'll be honest with you, I'm kind of on the scared side. My district currently is performing low compared to others in the district. I don't know if in some regard this will level the playing field or if we will fall even further behind the curve. So once again, what I do like about this time that we're in is it forces us to be innovative, whereas we may not have previously. It forces us, like Dr. Ellis said, to have to collaborate. I'm from the Delta, so I think I can say this safely. We have been notorious for being an island, being islands. We'll have 5 or 6 districts within a 50-mile radius, and we were all doing our own thing. We're at a place now where none of us know exactly what we're going to do, and we can't help but rely on each other and collaborate and work together. So in some regard, this pandemic has forced us into some uncomfortable scenarios we've been needing to explore prior to now. So I'm looking forward to, you know, the plan that we can come up with and moving forward in an effort to meet the needs of all our students as best we can.
I appreciate you sharing that. And you're right with the little islands that do exist. I'm excited about the opportunity for our leaders across our Delta. And it's not just the Delta, it's across our state who are functioning in islands and silos. We need to put our minds together and think about everybody and not just some. But our next question is about how many Black children in your school district have access to pre-K? And what stops you from having more students enrolled? And what impact would it have to see more students included in pre-K? All of our leaders are not going to answer this question. A couple of them are going to jump in. The remaining 4 questions, all the leaders won't try to tackle them. So if you're worried about time, people, they're not going to try to tackle them, but a couple of them will tackle each question. So I'd love to hear from them. I particularly want Dr. Green to talk about this because they're doing some work around pre-K that's groundbreaking, transformational, it includes the entire community. But let's jump at it. What's happening with pre-K?
Okay, don't build it up too high, brother, because you know folks will be taking notes and keeping score. We have built in, Strong Start is actually the first of 5 commitments that we built into our strategic plan, which we launched this past summer. And so we have committed to ensuring access to high quality pre-K for all of the scholars living in Jackson. And we know that we're not the only players in that space. We're partnering more closely with the collaborative here in the city with some of the private providers, with Head Start. And so right now we're at about, our best estimate is about 2/3 capacity. We have enough pre-K seats for about 2/3 of the scholars here in the city. So, you know, that's still a sizable kind of gap there that we're seeking to fill over the next 4 years, increasing the number of seats. You know, part of the issue is just, one is building public belief and consensus that pre-K is school, that it is important, and that it's not just a nice to have. No, you gotta have it. Because while little Eric might not have access to pre-K and struggle and show up in K with whatever he has learned or whatever he's developed. The next little child who didn't go to pre-K has traveled the world and has a family with, you know, vocabularies that are such that they're just really, really stretching his brains and all of these things, right? And so we're not similarly situated, even though neither of us went to pre-K. And so as we think about the importance of pre-K and how it readies us, not just for K, but, you know, going on through our schooling, and the habits of mind, just how we think about learning, attitudes that we have about learning, all of that that's built before and certainly in pre-K is hugely important. So we're excited to be building on that. We're excited to be partnering more closely, understanding that we don't have all the answers, we never will, but together we should have more of the answers and more of the strategies and more of the resourcing to, you know, that rising tide that raises all boats. And last thing I'll say is just getting clearer and greater consensus on what quality actually looks like. I'm not fighting with you, you know, other providers about what quality looks like. When they show up in K, and you mentioned this earlier, the readiness assessment, when they show up in K and they're not prepared to engage, we got an issue. And that's whether they were in my pre-K program or another pre-K program. We just got to be honest about what that is and how it plays out in their lives without blaming, but just being honest when this is truly about what's in the best interest of the. I'll stop there.
Yeah. Do we have at least two other superintendents who want to talk about pre-K?
I'll chime in. In Meridian, we have had a pre-K program in place for about 20 years now. And annually, we educate over 200 students each year. What we found initially was when we started looking at community discussions and conversations around our pre-K program, the data was very clear. Those students that participated in the program actually had higher success in our classrooms, in their K-12 experience, higher graduation rates, higher success in college. So we've been able to track students over the course of the years. The barrier for us becomes when we compare what we offer compared to our local partners, we tend to say, what's holding our families back? Because we still have about 40% of our students that don't even participate in pre-K or Head Start. So knowing the research is very clear about that early learning experience, the exposure to the structured classroom, the exposure to pre-engagement opportunities in a learning environment. For us, it becomes how do we expand that conversation even more with the community to tap into that 40% that they're at Big Mama's house, they're nowhere, because we need those students now more than ever when we look at the inequities that are going across the board.
Yeah, and I believe, thank you so much for sharing that. You know, we have had lots of pre-K programs in many places for multiple years, and I just appreciate the work that you're doing to interrogate how do we get them out of Big Mama's house, so to speak, and get more kids sitting at the table. And, you know, we added this part of the conversation because the caucus is interested in learning more about pre-K and being able to support it in a deeper way. And so Senator Turner Ford wanted us to add this topic. And Dr. Dace, I think you wanted to share a little bit about the work that's happening with pre-K and some of the barriers that you all have faced and some of the successes you all have had in Greenville.
Yes, so again, like you said, newly minted superintendent here. I came into the district and actually we have a pre-K school. And so basically now the enrollment at that pre-K school, if you think about district-wide, we have about 4,200 students district-wide. We roughly have about 165, 170 students in our pre-K program. We basically is the mindset of the parents and the community because we can accept more students. We actually have the space. So what our goal is right now is to go out into the community, establish more partnerships, and just talk about the importance of a structured pre-K classroom. And so we actually have seen some gains. Actually, when we look at our kindergarten data from last year, the majority of those students, the 330 students we have in kindergarten, we made a 190-point gain across the year with kindergarten readiness. So the data supports the notion that truly kindergarten, which is not mandatory, but those students who actually attend kindergarten are far more successful when they enter first grade. Herein lies the issue with first grade. So it trickles from pre-K to first grade, where we see where the data is showing that our students are not where they need to be in first grade. And once we track those students back to kindergarten or pre-K, we see that those students that attended pre-K and kindergarten, they fare much more better when it comes to that third grade gate. So the data is there. It shows us that students are truly learning and that it makes a difference when early literacy is a part of the trajectory. So definitely we have great stories, and some of my staff administrators are on the call, but pre-K is actually, it's a great point for us right now, and we're looking to expand our pre-K program.
Yeah.
Can I just add one? So I think a couple of us made comments about young people not being in pre-K and being at home and that, and I think we would all agree that while it is really important for our young people to be in structured programs where there's a level of quality and intentionality in the learning, as well as the socialization, but in the learning, academic development, there's also a huge strength in the home environments and ensuring that whatever we're doing in school, pre-K on up, is rooted in, connected to, and is supported by, and that we actually support what happens at home as well. So it's not to totally dismiss what grandma or auntie, uncle, whomever is doing at home, but understanding that there's some things that home is just not structured to do. Not the least of which is you're likely not with a classroom of folks from very different backgrounds and whatnot perspectives. So just wanted to add that piece too.
Absolutely. We're going to transition to our next question. Just want to let you know that we invited some of our colleagues from the DOE. Some of them may be on the call. I know Ms. Crystal Cormack is deeply taking notes to be able to translate back to Dr. Wright. I invited her to the call as well. She had another call at this time. I don't know if she'll jump in or not, but just wanted to let you know that our folks from the DOE are here and listening, and we have someone who's listening to be able to carry some of this back and translate some of the experience who is sitting at the table. And that's Ms. Crystal Cormack. She is on the call, and you might see her in the chat a couple of times, but we're just thankful to have people from our DOE who are responsive and wanting to hear what's happening in our schools. Our third question that we have here is focused on what is the biggest issue your district is facing as regard to teacher licensure and hiring teachers? What barriers exist for your district to recruit and retain teachers? What innovations have you explored or are you exploring? And I'd love for you all to frame this and offer context around what this means for you amid COVID-19. There's also some opportunity to exist in the system because the flexibility with the new licensure guidelines, how are you leveraging those? So if we could get 2 or 3 superintendents to share on this topic, I'd love to hear from them.
I'll jump in on this topic here because in my district, we had an issue with licensure for a while. And so with the flexibility that you just mentioned, we're going to have a lot of room to make sure that those spots are filled. I do want to caution and say this though, a certified teacher in the room doesn't necessarily mean you're qualified to do exactly what is needed. And that's a big issue. So we got to make sure we understand. One of the things we're looking at is having to still train our newly certified individuals as if they have no true background in instructional practices. And so this COVID-19 issue makes it harder to do that. We're trying to train on 2 trains at the same time. We want to make sure that the old bridge is still secured while we're also transitioning to the future. And it's a hard thing to do when you're trying to make sure that people come to par, because you can work as hard as you want to work, but if it's not a true educator and you have true systematic methods of doing so, you're going to have a harder time making sure that those students get what they need in each and every classroom. I know we've done a marvelous job in my district of working with people who are not non-certified, but I'll be the first person to admit it's always easier to work with people who have that background already. So we're very grateful for being able to get that licensure piece, but we want to make sure that we continue to hire the very best that we possibly can, even in areas who have low industry means that are made attractive to other people. And you'll make those grounds over time, but we know it's a lot harder to do so when there's nothing to attract you to those locations. So what we try to do is say, we're going to grow you here. We're going to make sure that we plant something in you, and hopefully we plant something so well in you that you want to stay with us and you want to fulfill that obligation to help our students out.
Absolutely. Other superintendents, please jump in. Dr. Ellis, are you able to talk? I just unmuted you, Dr. Ellis. I know you had gotten muted again.
Yes, yes.
I know you want to talk about this, so I'm giving you the floor.
Yes, regarding teachers, we are doing everything in our power to take advantage of the waivers that have been offered by the Mississippi Department of Education to make sure that we utilize all of those individuals who are in our buildings now in order to get them certified. So we are taking advantage of those individuals. We are working hand in hand with those individuals, walking them through the process of what they need to do to become certified, because we know that if we don't grow our own, then we will be in trouble, because there is a quality of life issue, and we don't have a lot of people just on the bandwagon waiting to come to Macomb. So we need to make sure that we utilize every available body that we have in our school district to provide them with the necessary training, professional development that they need in order to get certified. We're also trying to take advantage of the programs similar to what William Carey offer that will allow our teacher assistants to become certified. And we're pushing them through these programs so that they can become certified, because we think that if we grow our own, then we have people who will begin to stay with us. We have people who are invested in the community, and now we have more individuals that we can provide high quality instruction to our children. One of the things that we also face is that it seems as though sometimes Macomb is a training ground for teachers. A lot of times teachers come here and they get all of the professional development that they need. We invest in these individuals and they leave us and go somewhere else. So that is something that we're struggling with. We have provided incentives to attract teachers. We are providing signing bonuses for certified teachers. We're also, in addition to the bonuses that schools and school districts get from the legislator for increasing test scores, we've also implemented something in our school district that if a school increased test scores, that everybody at that school, from the custodial staff to the principal, will receive a bonus. And if the district also moves accountability rating, then the district people who work for the district will receive something also. So we're just trying to make sure that we take advantage of every opportunity we have now to get everybody certified that we can by December of 2021.
And I appreciate you leaning into that. I want to also turn the conversation a little bit to retention too, because a lot of our efforts are around recruitment, and we fail to retain some of those people that are good in the seats. And I want Kelly Riley to talk a little bit about the work that she and her organization are doing to retain diverse teachers through national board certification and things of that nature. Because, you know, we don't want to spend all of our efforts recruiting folks when we got folks who've been there 10 and 15 years. We're not doing anything to keep them in the seat, and somebody else picked them up. And so, Kelly, will you talk a little bit about the retention aspect and some of the work you all are doing with diverse practitioners?
Sure. We've got a partnership with MDE. It's funded through the Kellogg Foundation via the National Center for Teacher Residencies. And we have a goal, we're about to start year 2 of the program. We have a goal of adding 125 new national board candidates throughout Mississippi. Of course, MDE has its teacher residency pilot program with 4 districts, including Dr. Green's district there at JPS. But we also offer the scholarships to 30 to 40 candidates from the state at large. And the scholarship reimburses the candidate for their registration with the National Board. We also provide the $475 in seed money for them to start their initial component. And then we also provide up to $100 in support provided by one of Mississippi's 6 world-class teaching programs. And if you aren't familiar with those programs, they are embedded at 6 of our universities, and they provide mentoring, peer review, and just technical assistance to candidates as they go through the process. So last year, we had 90 year one, and we're hoping that that will increase in year 2.
Yeah, and I just want to say, folks, understand that there's money that comes with being National Board Certified. You have an opportunity to have a bump of $6,000 and $10,000 in some places up to, you know, I don't remember the exact numbers. I should know this, Kelly, but what's the bump?
I believe we're up to 14 districts. It's the school districts surrounding the Alcorn State World-Class Teaching Program, as well as Delta State's World-Class Teaching Program. But National Board Certified teachers in those counties actually get a $10,000 stipend. So they get the traditional $6,000 stipend and an additional $4,000 on top of that. And of course, the stipend is significant, but just the difference in the teacher's practice and instructional practices and classroom management, I mean, it's invaluable, the difference that National Board Certification makes on a teacher's life.
And I just want to say this, and I want to give more space to the team on retention, but we have to also understand the additional stress, the compounded stress that's going to come with figuring this all out on teachers. And some folks are just going to check out. I am concerned that we're going to see an influx of people who got 25 years exit that door when they got to figure out how to do distance learning, or when they got to completely teach a different way. So does anybody want to talk about that or retention in any other way? We got time for one more person on retention.
I would like to, Cortez.
Okay.
Moving forward, when we're talking about teacher retention, we also need to realize that a lot of times we have many of our teachers that will leave the classroom and go into administration because they're paid more to do so. And our state really needs to look at putting in additional funding for our teachers. I know we talk all the time about a teacher pay raise, but what can we do to keep our qualified educators in the classroom? Not all educators are interested in going into administration, so we need to have some types of supports put in place to keep those qualified educators in the classroom.
Absolutely. I want to make sure I transition us to our next thought here in the interest of time, because we want to have time for questions. Our next question is, some have projected that schools could lose up to 30% of funding due to revenue loss between now and 2021. What impact would losing 30% of funding have on your school district? In the past, where have you had to look to make cuts as a result of loss of funding? And how would this play? How would this play out at the school district and classroom level for Black children? I really want us to think about losing 30% of our funding. We're not strangers to losing school funding in Mississippi. Many of you are waiting right now to make your budgets based on what happens with the legislature with school funding. But really want a couple of superintendents to talk about how this is impacting you, what kind of decisions you're going to have to make because of that. And I want folks on the call to remember that we're making assumptions. And so let's not run and say that Dr. Green or Dr. Dace or somebody said they're going to cut teaching units. Just understand that these are assumptions, that we're thinking through what kinds of decisions will have to be made. So again, we are making assumptions and we're making thoughts. So let's be careful not to run and tell everyone that these are things that's going to happen, because honestly, we don't all know yet what we're going to have to do. So a couple of superintendents who want to tackle the budget issue.
Well, I'll start by saying that we know, probably all of us on this call knows, that it's going to severely impact staffing because that is most of our budget. And for us on this call, that will be a huge hit to us because we cannot afford to not have quality teachers and those support pieces in place to educate our students. And also because we don't know what the future is going to look like. This funding is also going to impact, although we have the CARES funding, we will be getting the CARES funding, and it will take care of some of those pieces, but it's also going to impact how we provide support for those students addressing their mental health issues, providing support for all of those students who have special needs, not just those students with disabilities, but those students with special needs. Is also going to provide, is also going to impact our transportation pieces. How do we begin to transport students to school? I know Superintendent Taylor addressed it earlier about the bus situation. And also, will we have to have virtual platforms to meet the needs of our students? So this funding is going to dramatically impact how we move forward and how we provide learning for our students as we move forward.
I think one of the areas where some of us, maybe not all of us, could take a look is number of buildings we have open. As enrollment declines, not only across the state, and I've learned that sometimes neighboring districts are having the same problem I am. I always assumed when kids left East Marion when I was a principal, they were going to Hattiesburg. But I found out Hattiesburg's enrollment was dropping as well. When I was in Meridian, we assumed that kids were going to the county, but I found out the county's enrollment was dropping, and likewise here. We assume kids are going to Cleveland when they leave West Bolivar, but Cleveland's enrollment is down. So I think we always feel like neighboring districts are getting our kids, but the truth is a lot of parents are leaving the state for better opportunities, or a lot of parents are moving to the Memphis area for better opportunities. Some of us have an opportunity to close some schools. Some of us have an opportunity to restructure or to merge in such a way that we would not need as many teacher units. There's a savings there. Operational costs for buildings, utilities, there's a savings there. I think right now, with this possible cut in funding, it forces us to revisit our operations and could we trim back? Where could we cut? What luxuries are we enjoying that we don't have to have? And again, I figure it's a win-win. If ever you can put as many kids as possible under your star teacher, under the very best teacher you have, and you're not spreading those kids out under a mediocre teacher and some of them under a substandard teacher, and then the other third of them are under that outstanding teacher. If you get the opportunity to bring back that great teacher and put all the kids under that teacher, not only do you save money, but you also increase the opportunity for achievement. So I think one of the areas where I'm unique is we have already voted as a board to close 2 of our campuses. Now, spreading kids out and following the guidelines of COVID-19 and social distancing may cause us to temporarily open those buildings back up. But the decision has been made to close some campuses. And this particular year, closing those campuses has afforded me a luxury of having the teachers and being able to strategically place them. Right now, I'm looking at about 8 positions that I still have to fill in regards to teachers. And we've never been in that situation on the 26th of May. So right now, because of restructuring, you know, I'm feeling pretty good about the teachers we've retained. I'm feeling pretty good about the openings I still have. And again, we've got a pool of applicants to interview, which is, again, a rarity for us. So this little old Delta district may be turning some heads. Some of these curses may end up blessings before it's over. So I'm excited about that. But again, looking at, and I know Jackson recently made the decision to close some campuses. But again, I really think once you can get over the chaos from the community and them being appalled and marching in the street and rebelling, they'll eventually see that it was the best thing that could have happened for their kids. Because if I know Dr. Green, like I think I do just in the little time I've known him, he's going to put the best instruction in front of those kids. Kids may have to travel a little further, but again, that's a small price to pay for what he stands to gain.
Just
And
to
I'll just add to the fact that basically when you're thinking about budget cuts, and what Mr. Taylor said is quite true. My business manager and I had a discussion this morning, but with so many unknowns, that makes it difficult to make the decisions about budget cuts. If we're directed to actually open schools for students, that means we will need the staff that we're currently trying to recruit. If we're asked to go virtually, then that means then we need to make that decision about, okay, now let's trim down these non-essential staff, so to speak. You know, everyone is essential, but when we think about where we would make the cuts, it would be in the support staff. But then you really have to make the decision about, you're thinking about the social and emotional deficit for students. We don't want to cut out those support staff that will make a difference in how they're dealing with this new way of learning. And so there are so many questions and so many unknowns that even knowing if we knew that we had to make a 30% cut, it's really hard to pinpoint where we would make that cut. And so that's the tough part. I think we can look at it, and as everyone has shared, staffing, we would definitely start with staffing because that's the bulk of, you know, our budget. But we definitely would look at some other, you know, avenues. But again, the unknowns lead us to really, really caution, because we don't want to stop recruiting teachers and then all of a sudden, okay, we're going to bring everybody back into the buildings. Then we need to go, okay, we need to go find these 10 teachers that we decided not to bring to the table. So the sooner we get more directives regarding where we will be, or again, as a board, talking with my board on today, I mean, we can make the decision and we can move forward, but we don't want to have to change, you know, routes in July. So that's my biggest concern, is making those decisions with the information that we have now.
Yeah.
Before we leave, Cortez, before we leave this topic, I wanted to put the numbers to it. And I thought about a 30% reduction would be about 19 million less that we would have to operate on in Meridian if we ended up having to make those decisions. And the first thing you do is automatically say, how can I not allow the cuts to impact the classroom? And so when you start thinking about non-essential staff, like support people, for me, that means I'd be looking at behavior counselors, people who are in place to provide additional supports for students, additional supports for teachers. You'd have to look at training components. I'm like John, I'm in the process now of looking at which buildings could I close if that came to be a situation where that was an opportunity for us. So that would be conversations that would have to be had with my community. So there's so much that goes into this when we start thinking about where you would make the cuts and how those cuts could happen without having kids at even more of a deficit when you're looking at the inequalities that we have across the board already.
That's good. And Dr. Green, I believe you wanted to say something as well before I moved on.
Just quickly that, you know, we staff up in the ways that we do in reaction to and based on our context. And so I've got a number of folks whose work is focused around social and emotional needs and counseling and behavior management support, whatever it is. And then I've got a number of folks who are focused on teacher development. Well, you do that when you find yourself in a situation where you've got a number of young people who need support and you've got a number of teachers who are alternatively certified, newer in the profession, need additional supports and all those things. And so it's not just that you've got these folks sitting around because you thought it was cute and you want to employ people. You do it in response to the needs. Well, the financial cut come, but the needs don't go away, right? Right. So we got to continue to, help to the broader, I guess, community and public to understand this is not just about trimming quote unquote fat or excess people. we staff up in the ways that we do, we model our schools and districts in the ways that we do to support the needs that exist. And if those needs don't go away, then we can allow the funding to go away.
Absolutely. I am going to shift a little bit and not ask our last two questions. I'm going to ask one question and then we'll go and take some questions from the chat. But this is something that I failed to include, but I think is important. And please don't feel obligated to respond because I didn't preview this for you all. So, but I've been reading a book called Out of Mind by Sharon Draper. And it deals with a student with a disability. I am really concerned about students with disabilities and how districts are addressing and supporting students with disabilities. It was a concern of mine before this, but when I started reading this book, I just really got shaken last night and would love to hear some superintendents talk about how you all are supporting students with disabilities, what concerns you have, and then I'll open the chat for questions. And Dr. Watkins, do be prepared to come on and help with some of the questions that have been in the chat that we can elevate to the group because I want to get us out of here by 7:30. So we'll take special education and then take a couple of questions.
And I'll let others respond more broadly, but just to further express, not all disabilities or special needs are made the same, right? And so there are some that require way more in the way of resourcing and supports than some others. So there's that as well.
Any of our superintendents want to tackle the students with disabilities?
I would just say that even with these students with disabilities, we just have to also make sure that even the parents, they may not have the skill set or the capacity to even provide for these students if we have to go to a virtual, a blended learning model, because they have depended solely on the school district to provide the needs of those students with disabilities. So that is, in my opinion, that is going to be a challenge as we move forward as well.
Cortez, can I offer just from
Yes. Kelly, yes, sorry. I didn't mean to exclude you all from the conversation.
No. Just, I mean, all educators throughout the state did yeoman's work in literally flipping a switch and going to virtual distance learning overnight. But our SPED teachers, y'all talk out of the box, and they had all of the stresses that other educators did. Plus, I mean, it was IEP time. You know, trying to have IEP conferences and get the paperwork signed. You know, I just, if you have a chance, give them an extra shout out or pat on the back, because it was really a stressful time for them. And I really think they stood up and delivered in an excellent manner. And because they wanted to protect and provide for our students.
Awesome. Let me say something. One of the things I was talking to a friend who's a special education teacher this morning about this very topic. And she was having virtual sessions individually with her students with disabilities. And when she explained to me, she was having IEP meetings virtually and having to establish all of these new systems. Least restrictive environment is still in place, right? We still have federal guidance that guides how we support students with disabilities. And so those are things for us to think about. Anyone else want to share anything before I bring Dr. Watkins into the conversation to help us field some of the questions that were in the chat?
I want to say one thing there, Mr. Moss, if I may, on special education, because I think one thing we overlooking right now, and we shouldn't overlook, is the power of community and the power of those babies usually have a stronger bond with those teachers and those families. I know in smaller districts, we certainly do, because they've been raising them, they've been moving with them, they've been checking on them. One of the things we keep saying is we have to communicate, but I think we may want to go a step further. We can't just say we want to communicate. We want to make sure people comprehend what we're trying to communicate, because communication is us talking. We want to make sure, parents, how can you help us out with this? We know they love their children. We know, especially with our exceptional education children, they need additional help. So we have to go the extra step. That's like a family member for us, and figure out how we're going to get it done with them. There are, as Dr. Green said, there are no easy answers. We don't have all the answers, but it starts by having those real conversations and that real comprehension piece. Like, this is what your baby needs. This is what this child is going to need. How can we get it done? And that looks different in everybody's district, but the central point has to be the same. We have to figure this out together.
Yeah, I'll just quickly add. I mean, you know, we are struggling through it like many folks, and frankly, as much as we have worked super hard to be more compliant around students with exceptional needs, I wouldn't jump out there to say that we, you know, that we've done the level of work that I would like to see us do to really meet the needs. And I say that with the risk, at the risk of 175, 73, whatever the number is, people hollering at me later about, you know, whatever people think. Right. But along with that, I want to say that there's such work to be done around not just checking the box, meeting the timelines, not just submitting the paperwork and all of that around special needs, but fully understanding where the children are, fully understanding where they are today, because where they are today might not be where they are, you know, in another month or a year. So fully understanding that and having the ongoing back and forth conversation with parents, with family members as partners, experience those young people having all kinds of, typically, all kinds of successes, right? And triumphs at home. And then you're trying to tell them that the young person isn't doing school classroom, and they're like, but he's able to read this at, anyway, all of that, right? So the ongoing conversation, kind of to your point, Superintendent Garth, and at the end of it all, grace, building those relationships we have as one of our core values, relationships, building the relationships with parents such that we can be honest about what the things that we're not quite sure about and we're working through, but building the relationships so that we can give one another grace. I'm giving you grace as a parent that perhaps you don't hold up your end of this plan that we've developed to support your young person, and you're giving me some grace that perhaps we don't do things in the way that we should always in the classroom or in the school. But those are the things, frankly, that are getting us through this, or got us through the closure to the end of the year, of the school year. Having conversations with parents. Listen, okay, we're all living in this world together. We all understand that there's no playbook for how we do this for anyone, let alone for your baby who has some special needs. Can we agree that this is going to be a little different and we'll continue working through the solutions going forward? Those were some of the best engagements that we had with parents, where we just put it we put it all on the table. Let's be honest about where we are and how we might be able to work through this together. Grace for ourselves, for parents, and them for us.
Dr. Green, I appreciate your comment. One of the comments or discussions we had with my team not long ago is, instead of thinking about the fact that the children lost a whole 9 weeks or a whole quarter, we've talked about having discussions with families like, this is what your child brings to the table. This is how we together can ensure that we build upon where the child is, instead of allowing educators and teachers to focus on what we've lost. Let's look at what we have an opportunity to gain as a result of what we've experienced this last few months.
Well, I don't know if anybody else have any thoughts before Dr. Watkins, but Dr. Watkins, will you come on and take these last couple of minutes to ask some questions that we had from the chat, so that we can respect folks' time. I know the caucus will have more conversations about this. This certainly won't be the last one. But Dr. Watkins, you have been unmuted. So would you please take us through some of those questions you've heard?
Good evening, everyone. This is, for me, has been such an authentic conversation to hear these leaders talk about what has been occurring in their districts and what are their concerns, and to witness and hear how they are connecting to each other through these conversations. These conversations has really been refreshing for me. And there's a broad array of questions in the chat box, and I'd like to group them in this manner, and the panel members can respond to them as these questions resonate with them. First of all, for the panel members, if you were able to get guidance for your unknowns, as it might relate to policy, as it might relate to a legislative action, what would you need clarified from the State Department or from the legislature in order for you to address your unknowns as you plan for the fall? Number two, how are you planning to support your teachers social emotionally and your students? And number three, as we think about the return to school in August, as I put in the chat box, the elephant in the room is what we're going to do about the older population that's considered high risk around this particular virus, and those staff members who may have compromised immune systems. Feel free, panel members, to answer questions along that continuum or pick either one of them, as I've tried to group the questions along those three areas. And so I would appreciate any feedback as we...
All right, so who wants to jump in on those three questions?
I think I'll start. I think the first point of clarity for me has to be around how do we approach attendance, knowing that if we're able to go back to school in August, there's a strong possibility that I will be educating some children virtually, some children face-to-face. So if the legislature can have conversation with MDE about what attendance would look like, I think it's unfair to not account for a child who doesn't step foot in the classroom, although we're still providing educational services. So anything that they can do to provide us some guidance in that area, I think will be critical right now, as well as the funding conversation.
Frankly, I think it's always been unfair. We've got to move away from this ADA and go to membership, especially if our charter friends are going to be judged and funded based on ADA. Let's just be consistent. So agreed. For sure, the funding, just in general, what is that going to look like? Two, or as well, the limitations around, so right now, districts we're all out here trying to process through all the guidance, all the think abouts, considerations that everybody and their daddy has sent out. Right, everybody has an opinion about it. We're supposed to process all that and come up with the plan like the one down the street, because if it doesn't, then we're going to get dinged for that as well. Is there something, at the risk of having anyone outside of a school district or school tell us what to do, is there a set of guidance that we could have that says, look, we're not in a position in terms of our testing and contact tracing and whatever else we want to need in order to feel safer in this new normal. So nobody goes back to school in person. School has to be virtual. And in order to do that, here are the resources for the parents who got to work, right? Because that's a lot of folks' reality. These babies got to go to school so I can go to work, so we can all eat. So that kind of, we can't allow us to have whatever number of districts there are in the state, that number of plans and variations on the plans. We can't sustain that, and we can't support that statewide.
And I agree with you, Dr. Green. Yeah. More specific guidance instead of that's a local decision. And quite frankly, we can make a decision, but we don't want to make a decision and then in July, our decision is changed because of state legislation or because of MDE or whomever. And so I agree, we can plan better, if we were told, okay, we're going to go virtual, we're going to go blended, we're going to go face to face, if we had some more specifics around next steps, I think we could plan better as superintendents. Even with the budget, I mean, even if they say between 15 and 30%, if we knew what we were planning for, then we could make those cuts with that knowledge. And then I'm also on that membership. Right now, we're looking at possibly sending out a survey to just gauge how many parents will be willing at this point to send their child back to school in August. And we're gonna send that survey out. We may have 2 or 3 questions tops, because parents are tired of surveys, honestly. It is like pulling teeth to get them to fill out surveys, but we actually want to find that out. And if they don't attend, right, are we going to lose funding because of that in the future? So legislatures need to make that decision and help us with that going into it, knowing that also all those students don't attend school, then we have to do that much better in providing that virtual learning for them. So then we would look at dual learning opportunities for those parents who choose not to send their children to school. We still have the challenge of offering them that quality education. Mm-hmm. And so I think the unknowns, which we don't know who can answer those questions, but as far as the funding, of course, quite certainly the legislatures can do that one. I think Dr. Watkins talked about the older population. Again, we're having that issue right now with the staff that are here, not teachers, but we're talking about administrators, we're talking about counselors, we're talking about young staff who have older family members that they take care of at their homes. And so they're saying, Dr. Davis, I don't want to risk coming to work and then going back to my, grandmother or whomever with the COVID-19 issue. And so we're having to deal with that right now. Mm-hmm. So how much more of that will we have to deal with when school resumes? And then we have all of these teachers that may or may not have issues. So it's very problematic as far as, face to face. I think virtually we may be able to do it. But again, I know in my district, we're trying to fine tune what summer school is going to look like virtually, because we want to do a much better job than we did when we were closing out the 1920 school year. So we're using our summer program to kind of palette what we think we will have in the fall. So we're trying all of these things. We're not, and most people think we're just not at work and we're getting paid, but that is totally not true. We are definitely working. And so there are lots of things to be done. There are lots of ifs, thens. And so I just answers to questions, I think, will help guide the work. And I'm like Dr. Green, just give me some type of guidance and I can make a plan. We could create a plan if we know what we're working with. Do we need to purchase 10 more buses? We don't know what we need to do. Yeah. So, anyway, I could go on and on talking about what counselors are doing. They're doing Zoom sessions. We got more students that's reaching out to counselors via Zoom than they did when they were in the school building. And so, our support staff, they are definitely reaching out and helping students. I think we did a really good job having to close out the school year. So anywho, I'll stop with that.
Dr. Watkins had one more question for the close. Dr. Watkins, you should be unmuted, and then I will do our closing slide. I promise you the caucus is committed to engaging with constituents in more ways in the future. The Legislative Black Caucus will continue this conversation. This will not be the last time that we have this conversation. I know our professional education associations are always having these conversations. So we will be continuing these. So don't think this is the last of it. Dr. Watkins, you'll ask your last question. I'll do a closing slide and turn it over to the senator to be able to close us out.
So my last question is, what do you think, this is for the superintendents, and certainly Kelly or Erica can respond, but I'm really interested in what the superintendents are thinking. And what do you think the role of state testing should be for the next 2 years?
Non-existent, no. Actually, it should definitely be delayed because that's not what's on our minds right now. Certainly, if given the opportunity to improve from where we are in Greenville Public Schools, we definitely want to make some improvements. But right now, our focus is on making sure that not only our adults are able to operate effectively via distance learning, but to make sure that our students are as well. And I know there may be some districts that are, way ahead, farther along than we are. But certainly my thought processes right now are around, can we just provide quality teaching and learning to our students? And it goes back to talking about state testing, but we also talk about the exemptions that we have, as it relates to, seat time. There are a lot of questions around with our planning. Do we consider that? Or do we focus on ELA and math and science, And so lots of things, but definitely a delay with state testing.
Yeah, Dr. Davis, I agree with you on that as well. I would say this part, we shouldn't have state tests for the purpose of accountability standings. I think the only good that would come from it would be so we can see what the implementation dip would be with our new normal. How are our students performing under these new adverse conditions? And I think that would probably be the only thing we could technically use it for to be beneficial to us going forward. What's the first year of this implementation? How far did we fall in deficit mode? And what do we need to work our way back from? But in terms of accountability and performance accreditation, I think it has no place there.
Yeah, and I just want to say, testing is a widely debated topic. I always caution people who take a position around testing, and I will always do this. If it wasn't for testing, we wouldn't know that some of these inequities exist in our system today. So I think that as we think about testing, I don't think it needs to be done in the scale that we're doing it on now, but we should give districts an opportunity to decide what that looks like at the district level, instead of, large scale, because we have to keep a pulse on inequities. I'd love to say that every teacher is going to go in the classroom, close the door, teach well, or every principal is going to make sure every child do that. I just want to caution us that we need some measurement to ensure that folks continue to teach our children, because when we've not had it, they taught their children and they didn't teach our children. And so what we need to be clear about is having some way of measuring that. It doesn't have to be testing, but we need to have a way of ensuring that folks are teaching our children.
Cortez, if I could just offer, I think Mr. Taylor mentioned earlier how districts have collaborated on best practices and educators have collaborated. And counter to what you just shared, I think that's one of the most positive things when the accountability and the assessments are lifted. We have districts working together on best practices for students rather than, well, I can't share that with you because it might give you a higher standing than me and I'll look worse in the newspaper than you will. So, there are pros and cons to both sides of the argument. And I do think the collaboration is one positive that has come out of the changes we've seen throughout COVID-19.
I will tell you, and this is from someone who's still relatively new to the state, obviously to the district, I resent the fact that there's such a conversation that even now, in the midst of this pandemic, that such a front of mind question, what are we doing about the accountability system and about testing? I resent the fact it's become that for us. And so, I agree with several of the points that have already been made, but can we just call out the fact that right up there, along with how are we going to feed our babies, how are we going to keep them safe, how are we going to keep those of us who go home to elderly or medically fragile family members safe, is what are we going to do about testing? It really is a shame, frankly. Run tell that.
Listen, well, on that note, drops mic. Drops mic. But I want to say I am going to end my time here. I have enjoyed talking with you all, but as I end my time, it's befitting that I stand in solidarity with the family of George Floyd. And we take a moment of silence to give our respects to the family and recognize how inhumane this act is and how it's egregious and it goes against everything that we believe and we stand for. And so I just want to take a moment to lift up George Floyd's name and then turn it back over to Senator Angela Ford and just thank everybody for their time today. So let's just take a moment and honor that. All right, I appreciate y'all joining me in solidarity. I just could not go and not pause and do that on this call and take an opportunity to do that. Senator Ford, you have been unmuted. Have your way, Senator.
Thank you. Thank you so much, Mr. Moss. You have certainly put together an excellent slate of panelists for us, and to each one of our superintendents and our education professionals, we thank you so much for sharing with us. We've been taking copious notes. And Dr. Watkins relayed a number of the comments that were posted and kind of framed them for us to help shape the discussion. Certainly, there were interesting comments and questions raised in the chat box. So we'll go through those and we will reach out and engage you. Again, Mr. Moss, to help us in the future. To everyone who participated on the call, who listened in, thank you. And just know that the Mississippi Legislative Black Caucus is on duty. We're working. And we're doing all that we can to make sure that we're informed and advocating in the best interest of our constituents. Please like us on Facebook, reach out to us by email, and we're here to help. So thank you all again. Have a great night, and we look forward to engaging you all in the future. Thank you.